Well, hello, everyone. I'm Jane Dickinson, and I am a nurse and certified diabetes care and education specialist. I am the program director and senior lecturer for the Master of Science in Diabetes Education and Management program at Teachers College, Columbia University. And I am joined today by a student, almost graduate of our program, who I will introduce in just a second. I also wanted to let you know that I spend a lot of my time when I'm not teaching and dealing with class stuff, talking to people about language and messaging in diabetes and how we talk about diabetes and how we talk about people who have diabetes. And most of the time I give these talks to people who work with people who have diabetes. So healthcare professionals and caregivers and all sorts of different people. However, every once in a while, I get to actually talk to people living with diabetes and how the messages that we send and the words that we use make a difference in how people view us. And I say us and we because I live with diabetes myself. I've had type 1 diabetes for 46 years. And I am really purposeful about the words that I use when I talk about myself, because I want others to talk to me and about me in a strengths-based, empowering way. So we'll get into a lot more on that in just a second, but I want you to know Jessica Craig, who is a PT by background and has obviously seen and worked with a lot of people who have diabetes throughout her clinical career. And she'll tell you about her experiences as well. And I mentioned already that she's a student in our program, our first and only PT so far. And we need more. And so Jess, tell us about yourself.
Well, it's wonderful to meet all of you virtually. I am a PT and I've worked primarily in outpatient care. I have had the pleasure of working with many people who have diabetes. So this is a really important and topical conversation today. I'm also transitioning into health coaching, planning to work with people primarily who have diabetes. So it's an exciting time to be in this space. And I think contextually, I have also my mom, my late mom, who had diabetes. So I think I come to this conversation from the context as a caregiver, family member, and also someone who really hopes that they play a role in advocacy when it comes to diabetes. So I look forward to this talk.
All right. Well, I do too. This is going to be fun. And Jess and I always have fun when we talk. So here, you all get to witness our fun. So, so I'm going to share my screen and get the slides up, and then we'll get going. And we will start from the beginning. All right. So here we go. We're going to talk about talking about diabetes and why it matters, really from the angle or the context that the way each of you talk about your own diabetes really makes a difference for how people view you and how people will in turn talk about you. And let's see if it'll change. There we go. So I wanted to give you a little bit of background, first of all, on what we like to call the language movement in diabetes. And the language movement is all about changing these negative, shame-based, blame-based words that cause guilt, frustration, and anger, and very negative feelings for people living with diabetes. And if you think for a moment, you probably have many experiences where people used negative shame and blame based judgmental terms with you, or words or phrases or messages. And so we kind of decided years ago, actually, I've been interested in this language movement since the late 80s, early 90s. And the furthest back I've seen a publication on it was 1980, I believe. But you see a lot, you see it everywhere, you hear it everywhere, social media, everywhere. What tended to happen in social media was that people living with diabetes found a home, found a place where they could kind of chat and commiserate and compare notes and find support and things like that. And so there started to be this little underlying conversation about language and about messages and how people were really getting tired of this negative language that was out there. And so then healthcare professionals started talking about it, and we kind of took it from this place of let's lead by example. Let's eradicate these negative words, negative phrases, and let's instead use more positive, empowering words and phrases and messages so that people with diabetes will hopefully have a better experience in healthcare encounters. And so we've had a lot of groups around the world who have published papers, position statements on language. The International Diabetes Federation has a philosophy on language. The UK has a position statement. Canada has a position statement. Australia just revised and updated their position statement. They actually had the first one. In the United States, we published a joint paper between the Association of Diabetes Care and Education Specialists and the American Diabetes Association back in 2017 on the use of language in diabetes care and education. And so we've had a lot of efforts go into this language movement. Unfortunately, we're not that far along, and you will still see the problem words and the problem language throughout diabetes care and education. And so we really need people living with diabetes to get on board this movement as well and to help lead by example as well. And so we want to have this talk today to kind of explain to you why it matters. And I love this quote. I found this on Twitter, and it was posted by a woman who's very involved in the language movement. She's a diabetes clinical psychologist. She works for Deakin University in Melbourne, Australia. And she posted this, and it was part of an article. And this woman identifies as an Aboriginal person. She lives in New South Wales. And she said that basically how you identify yourself or how you label yourself reflects who you are. And so what you say to the world, what you say to other people is how they will interpret who you are and how they see you, and they will in turn label you accordingly. Just giving you a second to read this because it's really powerful. Mm-hmm. And then Christopher Reeve, Superman to most people, who unfortunately became paralyzed and breathing through his trach and so forth. And he said that once we choose hope, everything is possible. And it's pretty amazing to think of somebody who is in a wheelchair 24/7. Well, I guess except for when he's in bed or was in bed, can't breathe on his own, can't do anything on his own. And he recognized the power and the value of hope. And so if you get anything from this session today, I hope you will understand, no pun intended, how important hope is. And hope is really prevalent in our language and in the messages that we send through what we say. So take a minute and hopefully you have some paper and a pen or pencil nearby. And if not, just think about it. But it would be kind of cool to write it down as well. When you think about hope and you think about diabetes, what words elicit hope? What words bring out hope? Or maybe not even related to diabetes, maybe just in general, what words make you hopeful? And then think the opposite. What words crush your hope? What words that people have said to you or that you've heard around you or that you've read or seen on a billboard really like take away your hope? And I don't know, I don't mean to put you on the spot, Jess, but are there any you think of right off the top of your head?
I would definitely say to elicit hope, I think of things like trust, freedom, possibility, even independence, because there can be times where you may not feel like you have the independence to do some of the things that you want to do. And even something as simple as faith, people having faith in your ability, so those are some words that I think resonate with me.
Yeah, so when you said that having faith in your ability, I think of somebody who says, I believe in you, or I know you can do this. or
Absolutely.
you've got this, or things like that. You know, that to me identify or lines up with that having faith in me and therefore giving me hope. And it
Absolutely.
also implies a partnership, right?
Mhm.
Okay.
There's a collaborative theme there.
Yeah. Yeah. So I had the great opportunity to lead a focus group study back in 2015. And we actually held these focus groups. There were 4 of them. 2 of them were in person in the town where I live, and 2 of them were virtual. They were online. And one was in a live Twitter chat. Those of you, I'm sure many, if not all of you, have heard of DSMA Live, which is a Twitter chat every Wednesday night. And I believe it's from 9 to 10 Eastern time. And so we took one of those Wednesday evening chats and used it for a focus group where I got to ask people about negative words or words that affect them negatively in terms of their diabetes management, their diabetes experience. And 6 themes came out of that when I asked people, what words do you hear that you feel are negative or not helpful? And you can see that people felt that judgment, and they felt fear and anxiety when they heard certain words. Another theme was labels and assumptions. People really did not like being told they suffer or they're afflicted with diabetes. Words like that are sometimes referred to as disabling or handicapping. And you know, people live with diabetes. They don't necessarily suffer from diabetes. And so another theme was oversimplifications and directives, when people just say things like, oh, at least it's not, or you just have to do this, things like that. And then there was a lot of misunderstanding, misinformation, and disconnectedness where, you know, people just seemed like they didn't get it at all. And finally, body language and tone was another theme that came out of this. That is not just words. It's sometimes just the way someone speaks to you. Sometimes it's their tone of voice. It's their body language, their facial expressions. And so those were the themes that came out of this. And this was one of the the initial study that was the basis of writing the language paper that got published in 2017. And we have guidelines and recommendations that came out of that. So, you know, so when you think about negative words in diabetes, maybe those words that crush your hope, you know, just think about, do you relate to any of these feelings that people reported? And then think about, are there other words and phrases for you? Are there other things that people have said to you or to your loved one? And how did they make you feel? Jess, do you have any experiences in?
I think one of the things that I would like to point out, even from my mother's experience and also from my experience as a clinician, we like to think that adherence is the kinder, gentler compliance, but it has the same connotation. So, you know, I definitely, the phrases that you discussed before resonate for sure. And I would say avoiding going to health professionals because of how they spoke, I would say 100%. You know, my mom was a healthcare provider, so I think she was always very conscious about how she spoke to people and whether or not it would incentivize or support them in their own care, and to not receive that it can be damaging. So there absolutely were times where someone said, well, you know, you're not controlling this, or you're not managing it well. And it's complicated.
Yeah, there's a lot of that finger pointing, a lot of that blame and judgment, like I said at the beginning. And I mean, I've worked with many people who have told me that they didn't seek follow-up care because of the way they were spoken to. And when I had these conversations, they were in the ER or they were in the ICU with DKA. And, you know, if only they had been open to coming to see me when they moved to town, maybe we could have avoided that. But because of their past experiences that were so negative and the way they were spoken to and that finger pointing and judgment, they were like, no, absolutely, I don't want it. I don't want to meet with you. I don't want any part of it. And, but I want to go back to that word adherence that you brought up, and I'm glad that you did, because compliance is a word, compliance and adherence are words that are what we like to refer to as provider centric. So we're constantly talking about being person-centered and using person-centered care and person-centered language. And provider-centric is basically, you do what I say. I'm the one who has, you know, the intelligence and the knowledge and the answers and the power, and I'm going to tell you what to do and you do it. And when you do it, you're complying. When you don't do it, you are not complying, or you're non-compliant. And so way back in the early 90s, there was this push to get rid of the word compliance, because that was, somebody recognized that that was a negative term and unhelpful. Well, they didn't really get to the bottom of the problem. And instead, they just said, well, we're going to get rid of this word. And so then that's when they started saying, we're going to use adherence next instead. And I like to say that compliance and adherence are the same word, they're just spelled differently. And really, they both are provider centric. They mean doing what somebody else wants, doing what somebody else believes, following somebody else's set of beliefs, following rules. And I also like to say that diabetes management is not about following rules. It's about making choices and making decisions every minute of every day. And you all know that. You've all experienced that. So when you're talking to somebody about managing your diabetes, you could say, you could kind of, you know, just get in there the fact that diabetes is not about rules. It's about choices. It's about decisions, informed decisions, preferably. And I'm curious if you want to, you know, answer these questions, either jot down or think about, have you ever felt like giving up on your diabetes management because of the way someone spoke to you? Did you ever experience that with anyone, Jess?
I definitely think that, and from a clinical perspective, I have encountered, you know, people who are navigating diabetes who were surrounded by messaging from family, unfortunately, who thought that they were helping, but just kind of really undermined their belief systems about their own capacity. So they just kind of like said, you know, I give up on this because it just overwhelms me. And
yeah.
You know, it's unfortunate, because I think a lot of times you don't understand that when you're part of someone's life, you know, you have power in your words, and you can actually get the reverse of what you're hoping to establish. A lot of times these are things that are set out of fear, but they don't get the net result that you're looking for. So it's important that everyone is mindful.
I think that's a really good point. I don't think it is a good point and an important point, because it's also important to remember that your healthcare providers who you work with, your diabetes care and education specialists, your physicians, your, you know, whoever you see, your PT, we all have your best interests at heart. And we all do this. We all entered this career because we care about people, and we want people to be well and to have as positive health outcomes as possible. And we know that you want that for yourself too. And so sometimes our language, our words, and our messages get jumbled and get, like Jess said, it's not on purpose. It's not like family members who nag the person with diabetes and say, why are you eating that, or whatever. They're not doing that because they don't love them. They're not, you know, they want the best outcomes for that person. And so it's hard to kind of tease through that and say, okay, I have to help this person understand that the words they're using aren't helping me, knowing that they're not doing it to hurt me.
Absolutely.
So back to hope. I wanted to just, you know, talk about the positive side of this. Have you had experiences where someone talked to you about your diabetes in a way that gave you hope? Think about that and think about how can you build on those experiences. Jess, do you have examples of that?
I would say absolutely yes. So there was a time where there was a complication in my mom's health, and she actually needed now to kind of rely on insulin much more to kind of manage her glucose levels. And we had a really wonderful nurse who said, sometimes it can feel like a marathon or a sprint, but you stop and you just give yourself the time that you need to recover and you can keep going. And I think that was really important, to just have someone who's not saying these numbers don't look good and this is a big issue, but more about, this is how you feel. Don't be overwhelmed. And, you have this internal capacity. You can get this done.
Yeah.
It made a difference.
And to tag on to that, also kind of normalizing when someone is overwhelmed, like, this is hard. This is overwhelming. It's overwhelming to live with diabetes and to figure out all that you have to do and navigate all the appointments and the costs and the equipment and the calculations and all of it. And so it's normal to feel overwhelmed, and but take the time, like you said, take the time that you need, and you don't have to be perfect, and no one is perfect. So I often use that. I heard this years ago, that 1 out of every 4 blood glucose readings makes no sense. And when people hear that, they're like, oh, so it's not just me, so, and if you haven't had somebody talk about your diabetes in a way that gave you hope, what do you imagine that hopeful talk would sound like? I mean, think about that, and maybe solicit relationships, and surround yourself with people who use hopeful talk and who speak to you that way, and think about how you can encourage that, and in what you can say to help others change the way they talk. One thing that I do, and we'll talk about the ick word in a minute, the word diabetic. When people ask me, so you're a diabetic, I never answer yes to that question, because I don't identify as being a diabetic. And so I always say, I've had type 1 diabetes for 46 years, or I'll say I have diabetes. And my hope is that they will hear what I said, and they will hear that I did not say I'm a diabetic or I am diabetic, because I don't say that. So that's one of the ways that I do it. And I try to be very positive and informative, and help people understand how much it matters what they say and how they say it. Oh, so here are the recommendations from that paper I was telling you about. And they are, we'll go through each of them and talk about them individually. So you can kind of eyeball them here. And then I'm going to move into neutral and factual. So use language that is neutral and factual. It's the easiest way to remember it. Instead of saying things like glycemic control or good control, bad control, say what you're talking about. Say my A1C is higher than I want it. Or my time in range, I'm trying to get it up to 65%. And right now it's at 60%. And you're just talking about facts and figures. You're neutral. There's no judgment, and you're not therefore allowing any judgment in, because if somebody were to say to you, how's your glycemic control? You could say, oh, you mean my A1C? Like, you could just help them turn that around. Or you could say, what do you mean? Because glycemic control is such a nebulous term, and who knows what it means. What about you, Jess? What do you think of when you think of neutral and factual?
I think definitely the avoidance of uncontrolled, because it kind of feels like a freight train, and I don't think anyone wants to feel like their life is running off of the tracks. And I think when it comes to choosing your language, the thing that I think resonates with me the most is to kind of lead with empathy, because the disease doesn't exist in a vacuum, right? You have all these other things that you're navigating in your life. And I think if you think about it that way, and the people around you think about it that way, it's a lot easier to not be so judgmental.
Yeah, that's a really good point. And I put avoid good and bad on there because people often refer to themselves as being bad. Like, I'm a bad diabetic, or I mean, you wouldn't believe, I live in a pretty small town, and I'll see people in the grocery store, and they're like covering their cart, like they don't want me to look at it. And they're like, oh, I'm bad. I'm don't look in my cart. And I'm just like, No, I'm not judging. I'm not, and it makes me sad when people talk about themselves like that, because that's, again, the message that gets put out there. And that also indicates that they believe that they're a bad person. And so neutral and factual goes back to the numbers. Just talk about the numbers as numbers. And we tell healthcare professionals to just treat them as numbers and to not flip out if a number is really high or if it's really low. It's just the same. It's just a number and it's just information. Some people call it a data point, or, whatever it is that you're going to go and make a decision with. And so if you think of high numbers as being bad, then you tend to transfer that to I'm a bad person. And really, you're not a bad person. Those are just numbers. And you're actually doing a great job for having collected that information and for making a decision based on it. So it's all good. And don't judge yourself and don't let others judge you. Non-stigmatizing is important because there is a lot of stigma in diabetes, and stigma is actually defined as a negative mark. It's disapproval, and it's something about a person that other people either disapprove of or consider negative. And so it's often confused with stereotypes. And stereotypes, the difference is that stereotypes can be positive or negative, whereas stigma is always negative. So, and sometimes they overlap. In diabetes, there are a lot of stereotypes and there's a lot of stigma, and it's all negative. I don't know of any positive stereotypes in diabetes. Or maybe someone say, oh, all those people with diabetes know so much about food because they have to think about it all the time. So maybe that's a positive stereotype. I don't know. Diabetic, the word, comes with a lot of stigma. And that is one of the prime reasons to drop that word from your vocabulary and to avoid calling yourself that or calling other people that. It's a label. It tends to define someone as their disease. And because there is this negative connotation that people brought on their diabetes themselves, that they're at fault for it, or that they're at fault for getting complications, or that they're lazy and they don't take care of themselves and they don't care, all of those stigmatizing beliefs that are out there about diabetes get carried over into this word diabetic. And so we try very hard to replace that with person with diabetes, or women with diabetes, or children with diabetes, or whatever it is that we're talking about, whoever it is we're talking about. And, or just, I'm Jane, I happen to have diabetes. What other stigmatizing words can you think of, Jess, if any?
I think for me, the big one is diabetic is very pervasive, particularly in my culture. My family's from the Caribbean, and it's peppered. Yeah. That is how someone sees themselves. And I have many people in my life who didn't even want people to know. So they hid it. They hid their diagnosis. Yeah. So,
yeah. And we know that the stigma that is related to diabetes leads to, there's a belief that people with diabetes are, I mentioned, like they don't care, they don't take care of themselves, they're lazy. Believe it or not, it's connected with a belief that they're poor, that, they don't work, they don't, all these terrible beliefs about people who have diabetes. And what it can lead to when someone is feeling stigma, many things, I'm sure, but two of the big ones are isolation, where people don't, back to that lack of follow-up. They don't want to go back to providers who are stigmatizing, or they don't want to go out and hang out with people who are stigmatizing. And so they keep to themselves. There is less possibility, or people aren't as likely to talk about their diabetes. They're not as likely to share that they have diabetes, which can be dangerous. They're less likely to take part in research. They're less likely to, get help, like we already said 3 times. And there's self-stigma. And that goes back to that one, that good, bad, calling oneself a bad diabetic. That's self-stigma. That's like buying into it, saying, yep, I stink at this. I'm no good. I'm lazy. I don't take my meds. I'm non-compliant. And people really do start to self-stigmatize, and they start to believe these messages that are around them. And so that is what you have to fight against. That is what you have to push through and say, no, that is not who I am. I do not believe that. I'm not going to buy into that. And therefore, I'm not going to talk about myself that way. So strengths-based is big, kind of the central theme in the recommendations and the guidance in this paper. And this is basically a way of looking at what is working, what is the person doing, what are you doing, what are you doing well, what are you doing at all, what are you barely getting by at, but you're pulling it off, and then focusing on that, focusing on someone's strengths. And so the way you can do that when you go to your appointments or when you talk to other people is you can talk about what's working. You can be like, oh my gosh, I am so good at whatever. And then you can also ask questions, and you can take, the upper hand and say, I have these questions. I wrote them down before I came in, and I'm not leaving here until I get them answered. And, what do you need help with? What do you need to do differently or better? And get help with that, and use your strengths to do that. And then also think about what you call your numbers when they're in range or out of range. Do you, and maybe you could share that with your provider or with your family members. And you can say, you know what, I don't want you to call these bad numbers. I really prefer that you call them high, high numbers, or out of range numbers, or whatever it is that works for you. So when you think of strengths-based, Jess, what do you think of?
To me, I think about finding the thread that allows someone to master one thing and trying to see if they can connect it to the other parts of managing their diabetes. And sometimes it doesn't even have to be necessarily related, because even for my mother, I was like, you have certain rituals that you're able to kind of pull off every day. And, is there something that you find that works for you, or a time of day, or a time where you don't feel as stressed, where you can engage in some of your self-management? So I think everyone has this internal capacity, but it's to kind of focus on, again, like you said, what is working for you and not what works for the people around you. And I think that's a big challenge, because sometimes the person with diabetes is more concerned about how their life is affecting other people. But you can't be worried about that and manage your own life.
That's such a great point. This is about you and your individual journey with this, and making it work, and living the best life you possibly can. In terms of a patient-provider relationship, we've been talking about that throughout, and I just want to highlight that the most effective relationship, it is all about relationship, and the most effective ones are going to be built on trust and honesty. If you don't feel like you can speak openly and honestly with your providers, then it's not a good relationship. And so you either have to, do whatever it takes to get there, or if at all possible, you need to find a different provider. Someone who provides support and guidance, not somebody who wags their finger at you and tells you what to do. You really, like Jess said earlier, it's a collaborative process. It's a partnership. Your providers should be on your side and helping you. And I'm just going to move to the next one in the interest of time. Person-centered is also, along with strengths-based, probably the biggest deal in these recommendations. And I just mentioned, it is about you and your individual journey with diabetes. And there's going to be some overlap with your friends or your colleagues on social media or whatever, that you're like, oh yeah, I have the same thing. Absolutely. You're going to have experiences that are similar. However, every person with diabetes is different and has different values and different motivation and all that. And so when we talk about person-centered, we are talking about the whole person in all of their contexts, the word that Jess used at the beginning of this session, and really not just labeling someone as their disease. A person is so much more than diabetes. And so that word diabetic goes back to the stigma, but it also goes back to that it's a label, and it's diminishing. And so I think that if, there's a lot of things to come away from this session with, but come away thinking about how you talk about yourself. What do you call yourself? What labels do you use, as that woman from New South Wales said? What labels do you use for yourself? And that will determine what labels other people use for you. And Jess, what does this one make you think of?
To me, the thing that comes across the most, or that I think about the most, is the cultural context, particularly when you think about their non-negotiables in your life about the things that you want so that you can enjoy life. So from, being in the Caribbean, it's food is a connection to your family, so to say that you can't have this, that's not negotiating a life that someone with diabetes actually would enjoy. So instead of having the conversation centered about what someone can't do, talk about what they're going to do, because they're gonna have what they want, regardless of what you say.
Yeah.
But really think about, okay, how can you incorporate this into your life and still reach the diabetes goals that you have set for yourself?
Yeah. And
to me, that's what it looks like.
And that to me is the definition of partnership. That acceptance and that working together and saying, we're going to figure this out. We're going to figure this out together, whether that's family members, caregivers, or healthcare professionals. It's a team approach. And and I think that's an important point about saying, not being focused on what you can't do. And really, that reminds me of, when somebody says, oh, is there anything here that you can eat? And I just kind of look at them like, I can eat anything. Like what, I can put anything in my mouth and chew it up and swallow it. Like that is not an issue. I'm gonna have to think a little bit more, but I'm not gonna starve. But instead of saying I can't eat something, what about saying I don't eat that? I choose not to eat that. When I eat that, my glucose goes crazy. So I just don't eat it. Or I won't eat it. No, I won't eat shrimp, or I won't eat, whatever. It's not an I can't in the diabetes world. It really isn't. And if you're thinking about it as an I can't, think about where that comes from. Was that a message that you got from a healthcare provider way back? Or was it a message you got from family members? Or was it a message that you gave yourself? Oh, I can't do that. Can't is, it's also very handicapping, like kind of like suffer and afflicted and things like that. It's like, oh, I can't. And oh, poor me. Whereas, puts you in the victim box. Whereas I don't eat that, or I'm not going to eat that tonight. That's my choice. That's my decision. And it's an informed decision because I know what's going to happen if I do, or because quite honestly, when I get home, I'm going to be having a piece of cheesecake, whatever it is. Yes, cheesecake is my dessert of choice. So anyway, so there you go, person-centered. And this showed up on social media recently. And I was so glad that somebody made the comment before I did, because I would have. But when I read this, I was so bummed, because I thought, I don't care what your endo thinks about your labs. What do you think about your labs? And really, that's such an important message. Have a happy sigh when you feel good about what you're doing and about how you're living your life, and where your numbers are, and where you're, that's you, that's yours. You own that. You have the power over that, not any healthcare professional or family member or whatever. Jess, what would you add to that?
I would definitely say, not only not having the epicenter of your life be around what other people think about your lab values, but also about what other people think about your choices, your life choices, your food choices. I think that's the happy side that you need to have, or that you should have, because that's a happy side that everyone else affords themselves, right? They don't sit around wondering what other people are going to think if I eat this or I do this or I choose not to do something. So I think it's really important, free yourself from that notion that you have to construct your life around what other people want.
And that may sound, I mean, you may be sitting on the other end of this thinking, yeah, that's easier said than done. When I have, my mom breathing down my neck, or my endo yelling at me at my appointments. And I really have heard of healthcare professionals who yell at people, which is unbelievable. So this is where it's your role comes in, where you have to help these people understand that that's not helping you. It's not helping you if they judge your choices. They can, they can support you by, and then help them understand how they can support you effectively. Because very often when, if you have a family member who's just nagging you or giving you a hard time or judging you, I mean, what are the odds you're going to want to go get in your car or in the closet or whatever and start eating Reese's peanut butter cups, so.
What are the odds that said family member has like a cigarette hanging out their mouth? So it's like, do I really need to hear what you have to say? I think we all need to focus on our own individual journeys and not think that we need to be in charge of someone because they have diabetes.
Yeah. So this takes us to what we've been saying throughout. What is your message to the world? Like, how do you want other people to see you and to think about you? And what words do you want to use to describe yourself and your experience and your beliefs and the way you manage your diabetes and what you want to get out of not just your diabetes, but your life? And it really does make a difference. And people really will read that, and they'll read it loud and clear, and they'll think, wow, he or she has really got this. They know what they're doing. They're informed and they're making choices, and, I'm going to back off, or I'm just going to ask questions or whatever. And that starts with, how do you think about yourself? Do you think positively about yourself? Because that is what will contribute to putting a positive message out there. And, be strong and be positive and have hope and do what it takes to get to that place. And, Jess and I are here to tell you that we believe you can do that. And we hope that you believe that too. Is there anything else, Jess, that you wanted to say that didn't come up?
I think the main thing that I would say is that I acknowledge that there is how should I say? There are sometimes cultural messages that are pervasive. So it's a lot harder than it sounds, but I think that each of us can individually play a role, particularly if you're someone who's living with diabetes. You can play a role in changing the cultural belief systems around you and informing family members, and it can really have a huge impact to destigmatize. So I think it's important.
Yeah. Well, this was the reference from the study that I shared with you. And then this is our contact information. And Jess, do you want to say a word about Shift and why it's up there?
Say that again?
Do you want to say something quick about Shift Diabetes and why that website is up there?
Definitely. For all of you that are watching this, we'd love for you to join us at shiftdiabetes.org. We are working on a large project, also working in collaboration with Casey from Diversity in Diabetes. So we would really love for you guys to sign up, and we will be working on a global collective about shaping the way we think, speak, and act in diabetes. So it's an exciting project that we are working on at TC.
Well, I really appreciate you being here, Jess. This is always more fun with somebody else, and when it can be interactive, even though we're just being recorded. And I appreciate you sharing your experiences.
It was my pleasure. Absolutely.
All right. Well, thanks, everybody. And I'm going to stop sharing and stop recording now. So have a great rest of your conference.
Yeah.